Now, this is the last video in our four-part series in honor of Medical Billers Day, which this year is on Thursday, March 26, 2026. Now, Medical Billers Day is usually on different dates, but it's always the last Thursday in March. So make sure you check it out each year. Now, in this series, we talk about how medical billing fit into the revenue cycle. And if you don't know what the revenue cycle is, I will make sure that I link a video telling you all about it. And also, I will put up my interpretation of the revenue cycle and let you know where we are at in this particular video within that revenue cycle. You will see different interpretations of the revenue cycle, but I am going to show you mine, and hopefully you understand it and you understand what each video that I have been doing during this series, where it fits in to what a medical biller does within the revenue cycle. And in today's video, we're talking about patient management. And as medical billers, we help patients understand what the insurance companies don't explain. I remember working in a practice and the provider used to always say, "Why are you telling the patients this? Why are you taking so long to explain this on the phone or talk to them about this on the phone? Shouldn't they know this already?" But working as a medical biller, I have noticed that many times patients don't understand their insurance. They have it, they may know that they need it, but they really don't understand all the jargon and what their policy entails. And as a medical biller, I think it is my responsibility, or at least I make it my responsibility, to explain to the patients as best as I can and help them understand what their insurance covers and don't covers when it pertains to the practice that I am working for. I know that if they understand better about what's going on, how their insurance works, then it will make them more inclined to pay their bills, to follow up on what they need to follow up, to fix their coordination of benefits. It will help them help us get paid for the services that the provider is rendering. Now, what is patient management? Patient management entails patient statements, patient aging, calling patients, eligibility, verification, coordination of benefits, payment plans, all the things that are pertaining to the patient and their responsibility in all of this. Some patients have insurances where they're not responsible for any co-share, meaning any deductibles, co-insurances, or co-pays. But for most insurances, the patient do have a responsibility. And even when they don't have a responsibility as far as it pertains to their co-share, they have a responsibility when it pertains to what's even covered completely. When they have more than one insurance and they need to coordinate their benefits, they have a responsibility when it comes to all of those things. So in patient management, this is some of the things that we deal with as medical billers. Now, how is patient management done? Patient management is done even before the patient is actually seen. So when it comes to eligibility and verification, a medical biller may be responsible for this portion of it. And although in my opinion, this portion, at least to begin with, starts off at the front desk, but sometimes it is the medical biller who verifies all of this information before the patient even comes in. But it is very important, whether it's the biller or the front desk, whoever does it, it is important because we need to make sure that the patient has coverage. We need to make sure that their coverage is covering what they are coming in for. We need to make sure that they know what their co-share is, to bring in their insurance cards. There are just a lot of little things that they need to do beforehand. So actually, patient management starts before the patient is even seen. Now, after the patient is seen, this may be a time where you have to collect co-insurances, or you may set up a payment plan. With a co-insurance, as you know, you may not know exactly how much a patient owes because a co-insurance is a percentage of what was done. So you might not know what was done or what's going to be done until it's actually done. So on the back end, you may have to collect payment from the patient after they've been seen. As far as collecting copays, you can collect that beforehand, at the beginning. When it comes to collecting deductibles, again, you may have to collect it after the patient was seen if you have no idea what's really going to be done. It depends on the practice that you're in and the specialty that you're in, how you're going to work this workflow. but you, whether before or after, you will be dealing in patient management in some way. Now, of course, you may think about sending out statements. And with sending out statements, you can send out statements monthly, you can send out statements as they go, as you collect them. So I kind of do a little bit of both. I always send out statements monthly. So every month at a particular time, whether that is the between the 1st and the 3rd, or whether it's the 15th of the month or the end of the month, I try to make it as consistent as possible so that I can make sure that I'm sending it out on time within 30 days or whatever the time it is. I try and make sure that I'm sending out the statements consistently that way. Then you may also send it out throughout the month, because sometimes, you have a patient that has a really big amount, or you don't want to wait at the end of the month to send out that statement, and you may just send that one statement out within the time frame of the month. So it doesn't always have to be monthly or one time, but I would say for the most part, regularly I send out statements once a month. But throughout the month, if I need to send a patient a statement, maybe they may request a statement even though I've already sent them one, then I will make sure that I do that. Now, you can send statements by mail, of course. Most of the practice management systems have portals, and you can send it that way. You can send it by text. Just make sure that it's secure. You can send it by email. Again, making sure that it's secure. All of these ways should be a secure way to send your statements, but as technology has grown, we have gotten more and more ways that we can send out statements. So whatever is convenient for your practice and for the patient, make sure you send out the statements that way. And sometimes after sending a patient a statement, you may need to work with that patient in order to help get that claim paid. When a patient doesn't understand what they're supposed to do or who they're supposed to call, that is where a medical biller comes in. If they need to coordinate benefits, we can't do it for them. Let me make that very clear. We can't do it for them, but we can help guide them in what they need to do. Sometimes I have been on the phone with a patient while they're calling their insurance. They let the insurance know that I'm on the phone with them, and so then I can ask questions as well if I need to. I do all that I can when it comes to helping my patients out, because again, I'm the one that is familiar with how things work, and sometimes they just don't understand. So them not getting a claim paid because something simple as coordination of benefits is not, correct, and their claim is outstanding and they're being charged, they don't know why, they're frustrated. If I can help them, I try and help them as best as I can. So sometimes in the AR management process, you're actually talking to patients, you're trying to help them fix and figure out situations that's going on. And I don't just assume that a patient should know. Yes, it's true that they should know what they signed up for and their policy, but sometimes you just don't know. We're the experts as billers. We know what's going on. So if we can help speed up the process a little bit, I don't see a problem in doing that. And if you're a medical biller that's interested in getting this t-shirt, it is in my shop. I will link it in the description box below. The link is always there. I sell tumblers and mugs, t-shirts, and journals, just practical items that us medical billers use. And this one is my bestseller. I'm a medical biller. It's straightforward. It lets people know what you do, and it is actually a conversation starter. I have gotten many people ask me, oh, so you're a medical biller? And then they go into speaking about what they need, what they heard, all of that stuff. And so I love to wear it and use it as a marketing tool. I have them in different colors like black and purple. I love this aqua blue color, so check them out. Now, why does patient management matter financially and operationally? So as far as financially is concerned, it matters because if a patient has a balance, that's money that you're not collecting. Again, the insurance company is not always the person who owes money. And you may think that, okay, the insurance company they paid the bulk of the money, and let's say the patient only owes $100. But 10 people owing $100 is $1,000, and it adds up. So you want to make sure that you're also collecting not only from the insurance company, but also from the patient. You want to be able to collect deductibles, co-pays, co-insurances, and also be able to explain that to the patient. Collecting these amounts help financially But operationally, it helps as well because the sooner you can get this done within your workflow, the better. Collecting deductibles and co-pays and co-insurances can really make or break a practice. Nowadays, deductibles can be high as $5,000, $10,000. Their copays can be $50, $100 just for one visit. And if the patient is not paying that in advance or when you send them out a statement, that can be some big money that you are losing. And so when a patient understands what they owe, what they need to bring in advance, when you're able to talk to a patient and make them understand that, that will help your practice financially and operationally, so you don't have to continue to run down the patient, to send out a lot of statements, to do all of that stuff. If you speak to the patients in advance and let them know, so that they know, when I come in for this visit, my copay is always $100, and so I make sure that I bring my $100. And building a rapport with your patients, to me, has become more and more important. With AI, with outsourcing, with just all of the technology and the new age way of doing things, sometimes I think it can hinder us a little bit. Let me explain. When I get bills, because even though I'm a medical biller, I get bills, I personally know that I may have went to Dr. Jones and then I get a call from some random place telling me that I owe. First of all, if I even answer the phone, because let's be honest, who answers unknown numbers? Who answers numbers that are not familiar to you? And so if I even answer the phone, then I may get thrown off because I'm like, who is this calling me? I know I went to this doctor, not this place. Like, why is someone from New York calling me when I'm living in the Virgin Islands? I have to catch myself sometimes when I have these random numbers calling me. So sometimes as a medical biller, you have to understand how the patient feels when someone is calling them from a number that they don't even know, from a place that they never even went to. So for me, I like to make sure that I kind of build a rapport with my patients. I want them to know, if I'm not the person that they're seeing in the office, if I'm not someone that they see every day, I want to make sure that it's clear where I'm calling from. And I kind of give them a rundown after I've made sure that it's them, why I'm calling, what happened. Just try and be friendly and make that relationship feel genuine, feel like I'm not just some random person calling them about payment, because I think that can be very off-putting. Sometimes I suggest to my providers that the front desk calls the patient, and it depends again on your practice and how your practice flows. In certain situations, let's say sometimes in therapy, when the patient is coming regularly, they see a certain face all the time, then you may need for a specific person or someone in your practice that they know their voice, that they hear all the time. Call them when it comes to payments, when it comes to their insurance, when it comes to different things like that, just so that they can feel more comfortable dealing with that patient. So for me, as the biller, for the providers that I call patients for, because I don't do it for all of my providers, but for the ones that I do, I try to make sure that I really build that rapport between the patients, because that will make or break a practice, and that will determine whether or not the patient makes the payment. So again, happy Medical Billers Day. I hope you enjoyed this series, and I will see you again in my next video.